Hello friends. So you are rightly watching this video because probably you are either suffering from stress or you are having some white patches which has been suddenly seen in your mouth, or you don't either know it what is exactly happening in your mouth, and your doctor has told you that there are some changes in the skin that can be easily visible. So friends, today we are going to discuss part 2 of white patches in the mouth. And today our topic is going to be oral lichen planus. What is this oral lichen planus? What are the causes and how can it be treated? Everything we are going to discuss in this today's video. So come, let us have a look at this today's video.
Subscribe to my channel Dr. Mansi Shah for dental health care and tips.
Hello and a very happy morning to all of you. Here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So what is this oral lichen planus? Oral lichen planus, or first in general lichen planus, is a mucocutaneous disease. What is muco and cutaneous? Muco is standing for mucosal. That is the skin which is inside your mouth is called as mucosal or mucosa. So lesions which are seen inside the mouth, and cutaneous, that is the lesions which are seen on the skin surfaces. So it is a mucocutaneous disease and it is very common. Mostly the age affected is 30 to 50 years of age. So middle-aged people who are having a lot of stress, undergoing a lot of work, they have to show up somewhere and do something in their life. That is the age group where this kind of lesions are very commonly found. One interesting but a sad fact is that the women are the most commonly affected. They are the target audience for this lesion. Why? Because mostly at the age of 30-35, women have their job profile to be shown, they get married, they have pregnancy, they become new parent, struggling everywhere and trying to make up and be a good mother, mom, wife, a good business person, professionally showing up well. All this causes a lot of stress, and that is the major reason for lichen planus. Yes friends, stress. It's not only that the women are affected, men are also affected. They also show this kind of changes in their mouth. So coming to the causes now directly, I would say the first, as I have been telling you, the first main reason is stress. Psychologically, if you are not peaceful here, it is shown here. Friends, your mouth is the mirror of whatever internal changes are going out inside your body. So, if there is something which is getting disturbed inside, your mouth is the first one to show it. Then may it be white patches, some ulcers, anything. So friends, this white patches of lichen planus are caused by a lot of stress in your life. Now, I am going to tell you how can you deal with this, the stress also, and how can you treat lichen planus also. Keep watching the video. The next cause can be use of certain drugs, like a lot of antibiotics which suppresses the immunity and only the medicines are working in your body. So that is one reason. The second can be use of certain dental materials, like you recently had your dental visit and you can see certain changes that have been occurring, or there is some allergy kind of thing. Then this kinds of lesion are also seen if you have certain habits like alcohol, smoking. As we have discussed in the last video, smoking, because of the heat, the tobacco content, it causes lot of changes in the skin. Things which are happening because of smoking and alcohol as leukoplakia, which is going to be precancerous for cancer. So mainly that are the reasons. But yes, you can also have lichen planus because most of these habits are related to stress somewhere. You have stress, you switch to these habits, and then you probably get lichen planus. So this is how the cycle goes on. And this lichen planus can be secondarily infected with candidiasis, leukoplakia. So it is going to be terrible then. Okay. The next reason can be certain trauma that is taking place continuously, like you have dentures or clips in your mouth, continuous there is impinging, or there is some reason why there is continuous trauma, very less you will see lichen planus erupting because of this reason, but yeah, it can be one of the reasons. Also, certain major diseases like diabetes, blood pressure, because people are having this, a lot of mindset changes, then again they fall into stress because they're catching up a lot of infections, their health is not keeping well, and that's the reason lichen planus is erupting. These are the main causes, but as you know, the primary cause is going to be stress. Now friends, let me tell you how this lichen planus arises, or what is the thing that is changing in your body. So it is an autoimmune disease, that is your immunity gets suppressed and your own cells, your good cells are killing the good cells. So it is an autoimmunity that is coming up. So your good cells are killing the good cells, and that's how this changes, or this white patches arise. Now how do you differentiate this from leukoplakia or candidiasis? Now if you are very much keen on knowing the differences in three, keep watching my Monday videos, visit my channel Dr. Mansi Shah. There you will find in the white patches section all these videos which I have been posting. So leukoplakia is something which is plaque condition and seen confined to one region. It is in at one region. Whereas candidiasis, if you see, it is the one which can be easily scraped off. But lichen planus is very specifically seen on both the sides, here also and here also. It is mostly affecting the buccal mucosa, that is the areas which is behind this cheek, this region, and it is seen bilaterally, both the sides. Plus it has striae in it, so it has some lines which are white lines. Now if you have a single white line in your mouth, it is very natural, it is because of your teeth clenching on each other. But you have multiple lines crossing each other, there is some white patch, black patch, there is some redness, then that can be lichen planus. Now as you can see in the picture here, this is called as Wickham striae. This is nothing but where the lichen planus cross each other. Okay, so when this lichen planus lines cross each other, this Wickham striae are seen. Yes, it is a confirmed oral lichen planus. Also, I am not going to speak about the cutaneous, that is the skin lesions, because that is a complete different topic which we can cover. But remember, it is mainly this back side of the hand, wrist region, nails, which are first or primarily affected. So if you see something happening here and here, then make sure you 100% visit your doctor. So lichen planus is mostly asymptomatic if it is inside the mouth. Sometimes, very rarely, in certain cases, the patient might suffer from burning sensation, and the patient might have that spicy thing, like the normal food is also felt spicy in the mouth. So that is how you can differentiate. So that is one symptom which is shown. Otherwise, the lesions go asymptomatic. Now, coming to the treatment part, I would say that this lichen planus has a very controversies, that they are cancer forming, they are not cancer forming. Some say yes, some say no. So instead of worrying and taking more stress on yourself, I would say relax. Have some meditation, relax, give some time to your body, to yourself. Yes, especially women, you're running all day long. Please find some time. Meditate, keep your mind calm. Remove all the negative thoughts from your mind. And that is going to be the best medicine for oral lichen planus. Yes, calming yourself, keeping the negative thoughts away, getting your stress away is how the lichen planus goes away. And with that, there are certain drugs like corticosteroids which can be given through injections if the lichen planus is more, or it can be topically applied. I'm going to specifically not tell you the name here, because in this situation, if you have diagnosed it, I would want you to run to your dentist and get proper treatment for it. Then I would say that increase vitamin A and E in your diet, like eat more of carrots, raw leafy vegetables. That is how it is going to help your skin be healthy. Once your skin gets healthy, you are going to automatically start healing. Your body starts recognizing what is wrong, what is right, and it starts healing. So have good amount of exercise, meditation, good diet, and your oral lichen planus is definitely going to go. So be stress free and be happy. Yes, it goes off. Please make sure, instead of searching so many things on Google, getting stressed about it, oh my god, I'm seeing something wrong, I'm having something wrong, now this is going to turn into cancer, that thought is only going to turn it into cancer. So please don't. Relax. Nothing is going to go wrong. You can definitely deal with it and go visit your dentist, take proper medications, it will go off. Mark my words. And friends, remember that it has some amount of coming back. It does come back if your stress level increases. So make sure that you keep a track of it. As such, no other treatment is required. Sometimes the dentist might suggest biopsy and certain level of surgeries if required. Otherwise, a person can stay with lichen planus. So friends, if you have someone around you who is quite stressful, or you find someone who needs to watch this video, do definitely share it with them. Please go have a word with them and make them relaxed about it. Friends, do definitely like, comment, share and subscribe to my channel Dr. Mansi Shah. I post videos on every Monday and in Hindi on Thursdays. I am a dentist practicing in the city of Pune. So if you have any queries, you can definitely message me here on my email address and I can get back to you. Friends, wishing you all a very happy and healthy oral mouth and a very stress-free life. Stay healthy, stay happy and stay over fit. Thank you.